Hello and welcome to the Palmore Institute's video lesson series. My name is Lowell and today we will be looking at the senior reading course. So without further ado, let's begin. In this video lesson, we will be looking at Chapter 6 of Password 4, 3rd edition, and the title is What Causes the Placebo Effect? Right. As for our learning goal, in this lesson, our learning goal is to learn what researchers have found out about the placebo effect. So what do we mean by placebo effect? The placebo effect, it's a noun phrase. Basically, it means the improvement in the condition of a patient that occurs in response to treatment but cannot be considered due to the specific treatment used. Now that's straight from the dictionary. It's a little bit confusing. Let's look a little deeper in what we mean by the placebo effect. Let's review some background information about the placebo effect. Placebo is Latin for I will please. Basically, I will make you happy, and refers to any medical treatment that is inert or chemically inactive. The placebo has long been used in research trials to objectively test the efficacy or efficiency or the ability to work of a new healthcare treatment, such as a drug. Placebo is indispensable or extremely useful to the conduct of many scientifically based clinical trials. And ethical considerations require that participants in clinical trials be told that they may be given a dummy treatment, or basically a treatment that may not have any effect on their health. Usually one group of people takes the drug while another group, the control group, takes the placebo. And the placebo may be a sugar pill or some kind of other treatment that basically shouldn't have no effect. None of the participants know whether they're taking the active or inactive substance, placebo. Sometimes not even the researchers know, and in this case we call it a double-blind test. Comparing the results from both groups should indicate the effects of the drug. However, some people get better when they're taking a placebo. You might ask yourself, why is this? This phenomenon is known as the placebo effect, and estimates vary, but around 1/3 of people taking placebos for complaints, including pain or headaches or seasickness, will experience relief from symptoms. There are various theories that attempt to explain this phenomenon, but the underlying mechanisms remains a mystery, so we're not really sure why this happens. There are different types of placebos. For example, a placebo doesn't have to be a pill. It can be any inert or dummy treatment, such as special diets, exercise, physical therapy, or even surgery. And the placebo effect is triggered or created by the person's belief in the treatment and their expectation of feeling better, rather than the specific form the placebo takes, be it pill or injection, for example. There are some misconceptions or misunderstandings of imaginary disorders. If a person's symptoms are relieved by taking an inert substance or undergoing a dummy procedure, procedure is not really supposed to work, it seems logical to assume that their illness must have been imaginary. This is not the case, however. Medical research has shown that psychological states play an important role in the development of disease. For example, stress is known to increase blood pressure, and chronic hypertension is a risk factor for heart disease. Just as the mind can contribute to a physical disorder, it can also contribute to its cure. So your mind can basically influence whether you recover from some medical problem. There are other influencing factors. Some of the factors that influence the placebo effect include the characteristics of the placebo. If the pill looks genuine or real, the person taking it is more likely to believe that it contains medicine. Research shows that a larger sized pills suggest a stronger dose than smaller pills, and taking 2 pills appears more potent or stronger than swallowing just 1. Generally, injections have a more powerful effect than pills. Also, another factor is the person's attitude. If the person expects or believes the treatment to work, the chances of the placebo effect are higher or greater. Some studies show that the placebo effect may still take place even if the person is skeptical of success or doesn't think it will work. The power of suggestion may be at work here. Another factor is a doctor-patient relationship. If the person trusts their healthcare practitioner, their doctor, they're more likely to believe that the placebo will work. All right, let's take a look at some vocabulary for our reading passage. And here's our vocabulary task. For this task, please match the verb phrases 1 through 5 with their definitions A, B, C, D, and E. You can pause the video. Okay, now let's take a look at some more vocabulary for our reading passage. And please match the nouns or noun phrases 6, 7, 8, 9, and 10 with the definitions F, G, H, I, and J. Then you can pause the video. Okay, let's review your answers. Number 1, to block something, to not allow something to occur or to stop something. Number 2, to break the habit or to break a habit. It's a verb phrase meaning to stop doing a routine action or to end an addiction. Number 3, to have something to do with it. It's a verb phrase meaning to be related to something or a cause, but not in a way that you know about or understand exactly. And number 4, to be a part of something. It's a verb phrase meaning to be included or involved in something. And number 5, to be divided into things. It's a verb phrase meaning to be separated into parts or groups. All right, let's take a look at our vocabulary answers for the next set of vocabulary items. Number 6, a craving. It's a noun, a very strong desire for something. Number 7, a neurotransmitter. That's another noun, a substance in the body that carries a signal from one nerve cell to another. A study, number 8, is a noun meaning an organized experiment in which many things are looked at, measured, recorded, etc. in order to learn more about something. And a natural painkiller, it's a noun phrase, a chemical that is usually produced in the brain that can remove or reduce physical pain. And finally, we have number 10, a medical procedure. It's a way of doing something to fix a health problem, usually surgery, some kind of treatment. All right, now let's take a look at our reading passage. You may want to turn on the captions if you haven't done so already. Alternatively, you could use this as a listening task and replay it with the captions to check your listening comprehension. As you listen to the following reading passage, try to identify the answer to the following question. What has changed researchers' understanding of the placebo effect? Okay, so let's listen. What causes the placebo effect? Harry S. wanted to quit smoking. So when he saw an ad for a study on ways to break the habit, he called and offered to be part of it. The research was being done at a local university where Harry and the other volunteers, all people who wanted to quit smoking, were divided into 3 groups. The volunteers in Group A received nicotine gum. That's chewing gum with nicotine, the drug in tobacco that gives smokers the good feeling they get from smoking. When these smokers felt the need for a cigarette, they could chew a piece of this gum instead, and it would give them the nicotine their bodies were used to. The volunteers in Group B, including Harry, got some gum too. Theirs was just plain chewing gum, but they didn't know it had no nicotine. People in Group C got nothing. A group like this in a study is called the control group. After a 4-hour period with no cigarettes, Harry and the other volunteers had to write answers to a series of questions. Their answers show how badly they wanted a cigarette. Not surprisingly, the smokers in Group C, the control group, which got no gum, showed the strongest cravings. The smokers in the other 2 groups didn't feel such a strong need to smoke. What surprised the researchers was that the results for Groups A and B were exactly the same. That meant that the plain chewing gum worked just as well as the gum with nicotine. Why? The researchers thought it was most likely the placebo effect. A placebo is something that seems like a medical treatment, such as a pill or a medical procedure, but that doesn't actually have any direct effect on the body. Sometimes a patient has a good response to a placebo, and when that happens, it is called the placebo effect. The placebo effect was long believed to result simply from a patient expecting to feel better. In 1757, Benjamin Franklin, the American scientist and inventor, described it as the spirits given by the hope of success. People thought placebos tricked patients into thinking they were better when they really weren't. And doctors who didn't believe in tricking patients saw no role for placebos as a form of treatment. However, recent research has proven that placebos can have indirect effects on the body. They can cause changes in brain chemistry, the same kinds of changes produced by drugs. For example, when patients in pain believe that they are getting treatments that will help control their pain, their brains produce natural painkillers. Those painkillers then help block the pain. This means that the placebo effect isn't a mistaken idea in the patient's mind. It's an actual event in the patient's brain. As a result of this new understanding of how placebos affect us, they may come to have a useful role in treating pain and other problems by making use of the brain's own neurotransmitters. We still can't be sure why the smokers in Harry's group felt fewer cravings than expected. Maybe just the idea of getting treatment, nicotine in this case, produced changes in their brain chemistry. But maybe the people working with the volunteers had something to do with it, too. A study at Harvard University showed that when people on the medical staff were especially kind and helpful, patients had a better response to a placebo. That's from Kapchuk 2008. There could be other explanations too. Maybe the sugar in the chewing gum helps the smokers in group B feel better. One thing we do know about the placebo effect is that further research is needed. Okay, so let's take a look again at that question. What has changed researchers' understanding of the placebo effect? You can pause the video. All right, let's take a look at the answer. Hopefully your answer is similar to this one. Researchers have found that the placebo effect isn't just a matter of patients being fooled into thinking they were getting better. A placebo can actually cause changes in brain chemistry. Okay, I think that's about it for this lesson. Let's take a quick look at the homework before we wrap things up. Number one, if you have the textbook and haven't read it yet, please read and review pages 67 through 78 in your textbook. Also, if you haven't attended class, please do the exercises starting from pages 69 to 77. If you have attended class, please finish any exercises that you did not complete in class. And 4, if you are a current Palmore student, please choose 10 new words and phrases from chapter 6 and type 10 sentences using the vocabulary. You can email it to Palmore or hand it to your instructor, who will check it and give you feedback on your sentences. And finally, you can also do the optional online activities through the Password online workbooks. Okay, I think that is all for this video lesson. Thank you for watching. If you have any questions or comments, please leave them below.